patients who are facing terminal illness, actually they have a lot of distress. So by addressing the physical distress, it did help them to feel comfortable. And when they are comfortable, they are able to still practice things that they like.
Since I was mobile and not sick that time, my hobby was reading and plants. So I still have my plants with me, so I feel very happy about it. At present, I'm on fentanyl and morphine. Oh, especially the news from the States regarding about fentanyl is not very positive. So actually, I did ask my staff nurse, and she says that actually because they abuse the drugs, whereas I'm following what the doctor is telling me and the nurse is telling me. So I'm following to the prescription, so it's no problem at all. But it really helps me a lot.
There were actually very noticeable changes in her. So prior to the start of the opioid medication, actually she was very breathless, and actually the breathlessness eventually caused her to be very frustrated because she couldn't do a lot of things than before. She even ever had this suicidal thought before the start of the medication. And as of now, after the start of medication, she can tolerate longer in the psychotherapy sessions, and she can even go down to the downstairs for marketing with the helper helps. So after the start of the medication, it did help her to reduce the symptom, and she's less breathless.
Opioids may help with different symptoms. For example, for morphine, it actually can target shortness of breath and also pain in patients. So with opioid use in this group of patients, it does help facilitate managing their day-to-day activities, and in fact, it may even facilitate independence for them. I try to involve family members in order to educate and also motivate patients and the family members on the use of opioids for better participation in therapy. And when I get the family members involved, if let's say I serve a dose of morphine before therapy sessions, they actually can see the difference in how the patient participate and also engage in therapy. And eventually, their engagement helps them move more and also do things that they want to do. I had one recent patient who really wanted to have really wanted to shower, and but she was having both shortness of breath and pain, and I informed her that maybe we can try having a dose of morphine before showering, and she was agreeable to it. True enough, after we tried having the dose of morphine before the showering, she was able to do the showering task independently. Two common myths that I think patients generally have. The first one would be that they will be dependent on the use of opioid. So they are very scared that once they start, their threshold for the opioid gets higher and they will need to have more and more of it, and to the point where they become completely dependent on it. The second myth is that the use of opioids actually has very strong side effects or symptoms of drowsiness that they are not able to engage with their day-to-day tasks. So for a start, I will actually thank them for sharing their concerns and fears with me, and that I'll let them know that this is actually a first step to understanding them better, and that for us to work more collaboratively and having this common understanding actually allows them to be more open to the idea of trying. Actually encourage them to give it a try, because they have not tried, they don't know. So and if let's say they do feel they do sense that they are getting more drowsy during therapy session, and I can see that myself, I will relay this back to the medical team, and then the dosage of the opioids can be titrated a bit better for them. It's normal to feel fear yeah, and it's okay to feel fear or being very concerned, but at least this is the way forward in order to have better symptom control in the overall sense.
Well, not everybody will have the same side effect, depends. But for me, it was so far it's been smooth sailing. I have a staff nurse that see me often and my social worker, and they were very helpful. They give me a lot of confidence in taking this medication. So it was no problem at all. I only take it when it's necessary. So far it's been very good for me. I really improved physically and mentally with these drugs.
So by addressing the physical symptom, it did help to improve the sense of autonomy, that she still has sense of control, that she still can practice. And by doing things that she likes, it's actually improve her well-being, not just physically, but mentally.
For my advice, you should carry on whatever a doctor advises you is good for you, because no matter what, I think you should make life more comfortable. You should go ahead and accept the advice from doctors and nurses.